Let's study complications of cataract surgery. The operative complications during intraoperative complications during operation of the cataract. There may be posterior capsular rupture, anterior capsule, posterior capsule. So posterior capsule may get rupture. Lens uveitis glaucoma hyphema syndrome due to iris scaffing by anterior chamber intraocular lens. We can put the lens in different place. When we keep the lens in the anterior chamber, and as iris is the vascular structure, and due to iris rubbing, there it can cause uveitis glaucoma hyphema syndrome. Vitreous loss, which is the most serious. There may be expulsive choroidal hemorrhage, which occurs due to sudden intraocular pressure changes. In this, there is bleeding from the choroid artery, which is the short posterior ciliary artery. Damage to the superior rectus while passing bridal suture. Bridal suture is passed below the superior rectus in small incision non-phaco cataract surgery and extracapsular cataract extraction to stabilize the eyeball and get a better surgical view. Descent membranes of the cornea get detached, and for the treatment we can do desmetopexy, injecting air bubble or gas in the anterior chamber. Acute post-operative within 6 weeks. Acute post-operative complications of the cataract surgery, that is within 6 weeks. There may be iris prolapse, acute post-operative endophthalmitis. We will study about endophthalmitis in the next video. Uveitis, retained lens matter, hyphema, which is the blood collection in the anterior chamber, astigmatism, retinal detachment. We'll also about study about retinal detachment in next video. Toxic anterior segment shock syndrome, which is the sterile inflammatory reaction to toxic agents. And for the treatment, we give steroids. Flat shallow anterior chamber, as the wound will leak, ciliary choroidal detachment, pupillary block glaucoma, malignant glaucoma. Late postoperative, which is the after 1 month to years of the cataract surgery. Posterior capsular opacification, which is also called secondary cataract after cataract, but this is the misnomer because this is not a secondary cataract. This is the most common complication of cataract. Here we can see this is the lens, anterior capsule, posterior capsule. Posterior capsule opacification. Here we keep the intraocular lens, and this is and after cataract surgery, the patients may form plaque here, plaque in the posterior capsule. So this plaque act as a cataract. It occurs 6 to 10 weeks after surgery usually. So posterior capsular opacification causes gradual painless loss of vision. And for the treatment of posterior capsular opacification, we can do the laser posterior capsulotomy. And the laser is ND-YAG, and the wavelength used is 1064 nanometer, and the mechanism of action is photodisruption. Two types of posterior capsular opacification is Ilsnig pulse, which is the most common, Sommering's ring. Irving-Gass syndrome, in which there is cystoid macular edema, bullous keratopathy, vitreous touch, and intraocular lens related complications can be. There may be displacement of the lens, which is the sunset syndrome. In this there is inferior subluxation of the lens. Sunrise syndrome, in this there is superior subluxation of the lens. Lost lens syndrome, in which there is complete dislocation of the lens. Anterior capsular phimosis, there is contraction of the anterior capsule due to fibrosis causing intraocular lens decentration. Late onset endophthalmitis. So in the complications of the cataract surgery, we have operative, post-operative. In post-operative, we have acute post-operative and late post-operative. During operation, there may be posterior capsular rupture. It may cause when the lens is inserted in the anterior chamber, then it may cause uveitis, glaucoma, hyphema syndrome. There may be vitreous loss. It can cause the expulsive choroidal hemorrhage, damage to the superior rectus while passing the bridal suture. So damage to the superior rectus, vitreous loss, expulsive choroidal hemorrhage, posterior capsular rupture, uveitis, glaucoma, hyphema syndrome, Descemet's membrane detachment. So there is 6 complications during operative period. Intraoperative: posterior capsular rupture, uveitis, glaucoma, hyphema syndrome, vitreous loss, expulsive choroidal hemorrhage, damage to superior rectus, Descemet's membrane detachment. And acute post-operative is the iris prolapse or acute post-operative endophthalmitis. Uveitis, retained lens matter, hyphema, astigmatism, retinal detachment, toxic anterior segment shock syndrome, and flat shallow anterior chamber. So in acute post-operative there is 9 complications. There are 9 complications in which there is iris prolapse, then acute post-operative endophthalmitis, uveitis, there may be retained lens matter, hyphema, blood in the anterior chamber, astigmatism, retinal detachment, toxic anterior segment shock syndrome, and the shallow anterior chamber. In late post-operative, the patient have posterior capsular opacification, Ewing gas syndrome, displacement of intraocular lens, sunset syndrome, sunset, so inferior subluxation, sunrise, so superior subluxation, lost lens syndrome, complete dislocation. Anterior capsular phimosis, in which there is contraction of the anterior capsule due to fibrosis causing the intraocular lens decentration. Late onset endophthalmitis. So this is all about the complications of the cataract surgery. You can find these notes on the Telegram and the links are given in the description. Thank you.